With end of life care or care for our aging loved ones, we have terms like morbidity and comorbidity. This is the presence of illness or a disease, and sometimes it can be acute or chronic. However, when we are talking about those end of life stages of a human being, so with age, the older we get, the more chances of having chronic comorbidities because of the biology of our bodies. Our bodies change as we age, and we are not able to tolerate as much as we did when we were younger. And so because of that, with age, there is possibility of more chronic morbidity or comorbidities within our bodies. So you hear the term comorbidity being used with disease. Currently, I care for my dad. He has dementia. And a lot of times we talk of dementia and we talk of dementia. And a lot of times our elderly parents, when we are talking about one illness, it doesn't mean that is the only illness that they are suffering with. Many times, this illness has a second or a third and fourth other illnesses that accompany it, and sometimes these illnesses that are termed as comorbidities because they are appearing at the same time. Morbidity is the presence of one. Comorbidity is the presence of more than one illness. And a lot of times, these illnesses, they affect each other. The medications may interact with each other. You're trying to treat hypertension, and at the same time, you're trying to treat something else. And the medications that you're using for hypertension may be having an effect on the other illness that is in a person. So the older we get, these comorbidities can really complicate treatment for our loved ones, for ourselves, which is why self-care is really important in our younger years as we are getting older. Sometimes young people just think we are here forever, nothing can ever hurt us, nothing will ever change, everything feels so good, only to get older and you start experiencing aches and this illness and then another illness. We need to always keep in mind the things that we see with our grandparents, the things that we see with our parents. One time they were where we are and even younger. And they were young and healthy and vibrant, and they never imagined anything can go wrong. So if you are young and you're listening to me, pay attention. Start now. Start taking care of yourself. Start thinking about how you want to age. I know it's unimaginable. I know it. But start thinking about it because time goes really fast. I look at my children now and I can remember being their exact age, and it just seems like it was yesterday. I don't know where the years went. I look at my kids and I think, where did you come from? Just hard to imagine. But time goes really fast. And anyway, so illnesses that happen to be with our loved ones. There might be, for example, I care for my dad. He has vascular dementia. Dementia is the symptoms of diseases. So not all dementia is the same. Not all dementia is Alzheimer's, because I have very often times heard people say dementia, Alzheimer's interchangeably, and it's not one and the same. Dementia is very varied. There's a lot of dementias, over 100. But the cause of each dementia is the name of each dementia. So my dad has vascular dementia. Other people have Alzheimer's disease, which causes different symptoms, but all dementias have some similar symptoms, which can cause us to confuse for one thing. But it's not one thing. The treatments are different. The cares are so different. And you know it if you have a parent or a loved one who has the temporal the frontal temporal dementia. You know, it's very different. And a lot of people with Alzheimer's, the symptoms are pretty different. So, however, these illnesses, these morbidities, come with others. So my dad has dementia, and a lot of times you hear me talking about dementia. He also has prostate cancer. He also has glaucoma. So all these illnesses are together living in the body. We have a trash truck outside, so pardon the noise. So I just wanted to talk about comorbidities because it was one of the subjects mentioned for discussion. So caregivers, if you are caring for your loved one with several illnesses together, we hear you, we pray for you. For others that are not in that situation and you are supporting us and cheering us on, please do, because when you see a caregiver around you, and they're caring for their loved one, for example, with dementia, just know there's more to it than just the dementia, and we can support each other as communities. And also, the more the comorbidities, you remember, the more the doctor's appointments, the more the pharmacy trips, the more the phone calls. So these comorbidities complicate life at many, many levels other than the treatments. There's also extreme emotional, mental exhaustion that come with it. And then our loved ones might be suffering extreme pain because there are some people who have dementia and life is smooth because dementia is not painful. Usually, life is smooth. They eat and they are okay. But then there's others who have dementia and they might also have a heart condition or they might have arthritis. And so with the confusion and then throw the arthritis pain to it and they are not able to express themselves. So sometimes you see violence and you see the kicking and the screaming. And as caregivers, we don't know what's going on. We think our loved ones are just being difficult. So it's important to really try to understand the illnesses that our loved ones, the comorbidities that accompany the main disease. And there's usually one that is the main one. That is the primary diagnosis. So you go to a patient's chart with end of life terminal illness, and you might find they are talking of congestive heart failure. Every time they're talking about congestive heart failure, because that's the primary of the comorbidities. That's the one that is advancing very quickly. And so they focus on that as the primary, but that doesn't mean the others are insignificant or they are not causing problems. It just means the one that is the most severe and the most aggressive is the one that they put as the primary. But that doesn't mean the others are insignificant or any less. It just means right now we are thinking this is the disease that is more likely to take out your loved one. And sometimes over time, these comorbidities may interchange. One day they might think it's the heart disease, and then all of a sudden they discover a cancer that was not there, and all of a sudden the cancer becomes the primary, and now all of a sudden they're talking about the cancer, like the disease that was being talked about is gone. It's not gone. It just means now the cancer becomes the primary because it's what is likely to take the person out. So that's how these terms are used clinically. Is you hear morbidity, you hear comorbidities, and basically that's what it means. Is a person might have one illness, or a person might have several illnesses together living in the body. And remember, they complicate the treatment. For the caregivers, they complicate how you function because you are always on the run. You have to call this doctor, you have to call this doctor, you have to run to this appointment, you have to run to the other appointment, you have to run to the pharmacy today, and then you have to run to the pharmacy tomorrow. And then, so the more the comorbidities, the more they complicate life. So I share this, especially caregivers. Take care of yourself. Ask for help. If there's somebody else around or you have friends, um, sign up other people that can run to the pharmacy and pick up the medication. People that you trust, somebody that you very much trust, that can run and pick up the medication for you so that you can do this other thing that need to be done. Family members, do it together. You can have one that goes to the appointments. You can have one that runs to the pharmacy, because the more people do it together, the easier it becomes on everybody. So just wanting to share that it's a lot for caregivers, um, in a very brief way. Just wanting to share that because when you hear us talking about dementia all the time, or you hear us talking about heart disease all the time, that doesn't mean that's the only thing that is present. We are dealing with other things that maybe we are not talking about every day. So let us continue to pray for one another and to encourage one another. God bless.